as I know others will be joining us. But welcome everyone to our Financial Inclusion Matters journey, which continues on. And last month, just to give a very quick recap, on July 14th, we learned much about what's happening in the tax world for people with disabilities from Don Dill, who's a senior tax analyst from IRS in Atlanta. And for those of you that were not on the call or were on the call, it was an incredible session because I think he really shared relevant information with everybody. And I think for those of us, for many of us, it was first time information for some, you know, that the tax refunds are the largest amount of money a family receives in a year. And he shared that this particular program is the largest federal aid program for working families, and that in 2021, 25 million working families received over $65 billion in refunds, an incredible opportunity. And he described, which I had really forgotten about, Form 8888, which talked about split refunds and the opportunity now to actually, you know, take a few hundred or $1,000 from your refund for an ABLE account or for your savings bond, which, you know, is really important. And he also shared with us that the impact of the new child tax credit for 2021, which was probably just a pandemic special, but we're not sure. Congress needs to reauthorize if they were going to do it. But what we did learn about that credit was that if you did not file because you didn't have a reason to, but you do have children, that this particular credit is it'll go back 3 years. So you can still file and not lose that opportunity, even if it isn't changed back. You know, it's a 2022 deal as well. And I think for a lot of us, Don actually gave us, for the 6 states that are represented here, and that's Arizona, California, Delaware, New Hampshire, Pennsylvania, and Kentucky, he gave us the data for what tax money is being left on the table. And I think for all of us, it was probably between 20 and 30% of tax dollars, which is in the millions, was being left on the table. And we know, going back a number of years, IRS did 2 reports very specific to disability. And that was one of the major findings that I always was like, wow, that over $1 billion in tax refunds was still on the table for taxpayers with disabilities. And I don't know if there have been any reports on that of late, but that's just so important. So for those of you that are looking at, because we're winding up for all the presenters today, this is the last formal presentation, and then we go into our work groups and begin to look at, you know, what are the different cities going to take and use, and how is their ask going to go, and what programs are they thinking about. The IRS presentation provided tremendous opportunity for you to go to your board or for you to reach out to a community partner. So that brings us to today, which is extraordinary because we have a panel of seasoned experts that are going to, they're experts in competitive integrated employment, credit use, and managing assistive technology funds, Social Security benefits, and policy training. And all of these people have come together over the past, I don't know if it's 5 or 6 years, when ABLE was started, and formed the National ABLE Center, which is
Janet, are you there? Oh, it seems something's wrong with her internet. Janet, can you hear us?
I can hear you. I cannot hear Jeanette.
Yeah, it seems she has.
I'm back.
Okay,
Oh, there you
I'm
are.
back. I'm back. I just went completely blank here. And I was talking about Laura Scheller and her work with with the center today. And she is also a subject matter expert in the workforce work and has been a navigator. And we're so fortunate to have Marlene Uliski, who after her 35-year career with the Social Security Administration and working for the Florida Voc Rehab, actually has joined up with NDI again a few years ago, and really has helped NDI with the ABLE National Resource Center, providing guidance on the very complex issues and solutions that we know really want to say welcome. My father was a person with cerebral palsy, and had an incredible career, lived well into his 80s. Nathan brings with us 15 years experience as an ambassador for Ohio, and from what I read, it looks like you are one of the first people to have an ABLE account in the country called Ohio Stable. And his particular interest is in advocating for higher levels of self-determination for the disability community, especially for people with intellectual and developmental disabilities. So I want to welcome Nathan and this incredible team, and I'm going to turn it over to
So we've had a few little glitches there, but I'm assuming you're turning it over to me. Jeanette, my name is Miranda Kennedy,
Yes.
and I'm the director of the ABLE National Resource Center, and it's very wonderful to be here. I have to say, my whole background prior to coming on board with ABLE National Resource Center was working on disability employment. So I feel like I'm coming home talking to the Disability Employment Technical Assistance Center group. And I also want to let everyone know, I have a wonderful deep history working with Amy Gonzalez, as well as far back at the beginning of the millennium, Jeanette, not to age either of us, but being incredibly inspired by the work you've done in this space too. So thank you so much for inviting us to join here, myself and our team at ABLE National Resource Center, and the ABLE account owners who support us as well. So we'll go ahead and get started. And if we could go to the next slide. There you see us, and hopefully you see us on the screen as well. Myself, Nathan Turner, who's going to be co-presenting with me today. And we will also be supported, especially for our Q&A, by our subject matter experts who Jeanette gave some background on them, Lori Schaller and Marlene Uliski. So you'll be hearing their voices when we get to that session, that part of our session today. So if we can go to the next slide, please. So let me talk about the Achieving a Better Life Experience, or ABLE Act. It was signed into law on December 19th of 2014. And the law really does allow for the creation of tax-free savings accounts for people with disabilities, which is a significant game changer. And we're going to talk about what that means. ABLE accounts offer this new option for those who are eligible, who are people with disabilities, and we'll talk about that eligibility in a bit. But this offers that opportunity to save for the future while also protecting eligibility for public benefits such as supplemental security income and Medicaid. More than 8 million people are currently eligible to open an ABLE account and start saving towards their financial goals to improve their health, independence, and quality of life. You could go to the next slide. So today we're going to talk about who's ABLE eligible, who can open an ABLE account, who can deposit money into ABLE, what are ABLE qualified disability expenses, how to choose an ABLE plan, able and means tested benefits, as well as what is Medicaid payback. Let's go to the next slide. So who's able eligible? An able account, what it is it's a tax advantaged 529A. You may have heard of 529 college savings plans. This is the next line of code for the IRS, 529A savings accounts. And these are owned by a person who has a physical or mental disability or blindness that began before the age of 26, who also has received supplemental security income, SSI, and or Social Security disability income, SSDI, that began before the age of 26, or has not received SSI or SSDI benefits before age 26, but where they have a signed disability certification stating that their disability began before age 26. Of course, it's important to remember that a person does not necessarily need to receive SSI and or SSDI in order to be able eligible. We could go to the next slide.
Okay, and so I'm going to elaborate a little bit more on who is.
I'm sorry, Nathan, am I stepping on your part of the presentation
No,
here?
it's okay. It's okay. I can do this slide or you can do it. It doesn't matter.
Yeah, right ahead. Go right ahead, Nathan.
All right. So I want to talk a little bit more about who is able eligible and the different types of certifications that are necessary. So if one does not receive any benefits from the Social Security Administration, a disability certification must be signed by a licensed physician, an MD or a DO, a doctor of dental surgery or dental medicine, a doctor of pediatric medicine, or a doctor of optometry or a chiropractor, and must include a diagnosis that indicates a physical or mental disability or blindness that results in marked and severe functional limitations, which has lasted or can be expected to last for 12 months or more or result in death. And next slide. A person can share facts with their doctor about their having a disability that began before 26. For example, a person could share information about an IHE or information about disability-related medical care or hospitalizations before turning 26. This can help the doctor decide if they will complete the disability certification, indicating that the person's disability began before 26. Next slide. When this is signed, the ABLE disability certification should be kept with other important documents should the ABLE plan or the IRS ask for a copy. And ABLE NRC has a very handy example disability certification that's linked on the slide. And you can also refer to the ABLE decision guide, Am I Eligible and How Do I Open an Account? And one of the things I love about the electronic document is that it's very easy to share it in an electronic medical record with a provider to really make that process easy and simple. And Miranda, is there anything you think you'd like to elaborate on?
No, other than the fact that Nathan and I were just texting with each other yesterday because someone was asking, hey, I received SSI or SSDI before the age of 26. I'm not currently on SSI or SSDI. Do I still need to sign this disability certification form? And what's the answer, Nathan?
Yes.
Yes. So we're going back and forth. You know, there's those little bits of nuance, which are really important to know. So these are great questions, and these are the kind of questions we're here to support and can provide some guidance and information on, as well as we really encourage you folks to lean into those disability, to those decision guides that Nathan referenced. You're going to see a few more of those on the next few slides. And let's go ahead. Thanks, Nathan, and go to the next section, which talks about who can open an ABLE account. So this is a great question. We get asked it all the time. An ABLE account can be opened at any age. Oftentimes people think, well, up to age 26, this is for young people. Well, guess what? Someone could be 2, 20, 50, or 80 years old. We heard the other day that the oldest able account owner that we know of is 90. So certainly they're not under 26, but they just have to have acquired that disability before the age of 26. So a person can only open one and own only one able account. You can't have multiple, but those able accounts are usually opened and managed online. There's paper application and accommodations that can be requested from the able plan. Some, such as the state of Maine, you can walk into a branch. There's a lot of variety. There's many able plans, but most are opened online, like we said. And the able account owner, they have to have a social security number or a tax filer identification number. If we go to the next slide, we can see that this is the order in which those able accounts can be opened. First off, a person with a disability who has capacity can open an able account on their own behalf. An individual who is selected by that eligible individual can open an account for them. Next would be an agent under a power of attorney, a conservator, or a legal guardian. Next would be a spouse, parent, sibling, or grandparent. And finally, a representative payee, either at the individual or organization level, can also open an able account on behalf of someone, but this is the order of priority. Let's go to the next slide. So for a representative payee, if that person is to open an able account for someone, they would be subject to all applicable Social Security Administration policy rules, including proper titling of the account. Although there are various titles for an individual representative payee. And here's an example of how that would look, where it's the name of the beneficiary by name of the representative payee, or name of the representative payee for the name of that beneficiary. So for someone who's in that position at an individual or an organization level, that is how that would look. Let's go to the next slide. So people can go to our Get Started page to select an able plan and link to the plan's website. And in terms of opening that plan, and we encourage folks to write down the name of the able plan and passwords for monitoring that account and for checking the balance and to see those monthly statements. So this is good information to capture. Let's go ahead and go to the next slide. I'm going to hand it over to Nathan to talk about who can deposit money into an able account.
Thank you so much, Miranda. So from all combined sources, up to $16,000 per year can be deposited into an able account. And this is a calendar year, so it's January 1 to December 31. Unearned income from an employer or self-employment income, earned income from an employer or self-employment income, also unearned income such as unemployment compensation, alimony, inheritance, stimulus payments, tax refunds may be deposited into the able account. A 529 college savings plan, a special needs trust, or a pooled trust may also directly deposit funds into the able account. Next slide. The able account owner, their family, their friends, or a trust may directly deposit up to $16,000 in the able account in calendar year 2022. And these amounts can fluctuate on a year-to-year basis based on the IRS gift tax allowance. Next slide. And this is a really important slide for me as someone who works and also as an able account. An employed able account owner can deposit additional funds into their able accounts if deposits have not been made to a retirement account during the calendar year. This amount is going to change each year and is based on the prior year's federal poverty level. Able account owners who live in the continental US can deposit an additional $12,880 from their employment earnings this year in 2022. And for people who live in Alaska and Hawaii, it's very beautiful to live there, but also very expensive. The amounts are higher. And we have a fact sheet on the ablenrc.org website that talks about able to work. Next slide. Remember too that any earned income or income due to the account owner is still counted as income when directly deposited into the ABLE account. This includes child support, pension, retirement benefits, or workers' compensation, and those are covered as unearned income even when deposited directly into the ABLE account because it's due to the beneficiary. And I think here it's important to note that a lot of the value from ABLE accounts comes from sheltering resources and not necessarily income. So do remember to report income to all of the appropriate agencies as applicable. Next slide.
And I'll go ahead and cover this one, Nathan. I know that the really important thing is talking to a benefits advisor, a certified work incentive coordinator, as Nathan mentioned before, just so you really understand. So the individual really understands that's who they should be accessing in order to be able to take a look at those deposits as well as who's opening the account, support around those other features. So we want to talk about this. We don't have the second quarter data for this year, but as of March of this year, when we're talking about who can deposit money into ABLE account, we thought it might be helpful to show you how much money is in those accounts currently. And the average account owner has saved $9,300. That doesn't include the amount of money that's been spent. That's the amount of money currently under management in ABLE accounts per account owner. That's the average, which is a significant amount higher than the $2,000 limit for many folks who are receiving means-tested benefits. And of course, can serve as an excellent alternative to having to spend down money that they might have. When we talk about that amount, keeping in mind that currently there's 120,000 ABLE account owners with $1.112 billion under management in those ABLE accounts. And that's really powerful for those folks who have opened ABLE accounts. These are people who are really realizing the opportunity. When we think about that amount of money, though, oftentimes people think, well, gosh, how could you even save, you know, $9,300 in an ABLE account? Where do you find the money to do that? It's a challenge. We have an ABLE decision guide that can provide helpful tips to folks on how to find funds, not just to save in an ABLE account, but even how to find funds to open that ABLE account. If you need that $25, $50 to open that account. Although there are some programs that have a $0 amount to even open an ABLE account at this point. But again, checking out those decision guides, that finding the funds to save in an ABLE account decision guides key. If we could go to the next slide, and I will start talking about a great question. What are ABLE qualified disability expenses? These are called QDEs. So you'll hear me say QDE from here on out, but they're qualified disability expenses. And what these are is that a person who has a disability, we know they often have more expenses than a person who does not have a disability. It can be very expensive having a disability. And households containing a working age adult with a disability require on average 28% more income or an additional $17,750 a year at the median household income in order to obtain the same standard of living as a comparable household with a member without a disability. So these ABLE accounts really make it so that a person can save to meet these extra expenses, which are wide in variety. And we're going to talk about those under QDEs in order to reduce any financial crisis or stress that they might have that's associated with not having enough money to cover that range of expenses. And of course, we know that that stress is increased across racial and ethnic groups where a lower percentage of people with disabilities saved for unexpected expenses compared to people without a disability. ABLE accounts are an opportunity to save for those unexpected expenses, those crises. If we go to the next slide, you will see here that the IRS has provided a list of qualified disability expenses that can be paid for from an ABLE account. And these are really just categories. The list isn't a list of every single thing you can buy. It's a list of categories under which expenses can fall. And it's meant to be broad, making room for the diverse needs of a range of ABLE account owners. These ABLE accounts can be used for services and supports, including day-to-day expenses. And they do not have to be disability related. They're called qualified disability expenses, and sometimes you'll see it say disability related, but you'll see that the categories housing, food, transportation, that's not necessarily specific to disability, right? So they do need to increase or help maintain the health, independence, and quality of life of the ABLE account owner themselves, though. That's one of the caveats here. They can benefit others, but they have to benefit that ABLE account owner. So let's go to the next slide. So some examples that we can provide you here include education as a category, and examples would include covering private school, college, tutoring, books, and fees. In terms of housing and some examples for that category, the purchase of a home, paying for home repairs, rent, dorm fees, utilities, property taxes, garbage removal, things related to housing, where potentially a parent of an ABLE account owner may use those ABLE funds to purchase a home that the ABLE account owner will live in. So that will be a feature of that and an opportunity there. Some transportation examples include paying for buses, taxi cabs, train, the purchase of a vehicle that's then made accessible, potentially with other funds and supports, repairs for vehicles, paying for a bike, replacing tires, things like that. You can pay for lifts and Ubers to and from work. We see that as an example a lot. But it also can be, if you have a 5-year-old or a 10-year-old, you don't have to have that ABLE account, that purchase made in their name. It just has to benefit that ABLE account owner. You're not going to give the ownership of a vehicle to a 10-year-old, right? Anyway, so that's some examples there. If you go to the next slide, let's look at a few others. We want to look at employment training and support examples. Obviously, housing and transportation, that all connects with employment, of course, but here's some very specific ones. We know there might be services and supports that are paid for through other means, but if people need additional job coaching or additional support with a job assistant, or paying for certifications or licenses where kind of going through the system might pay for it, but it might take a long time and someone just wants to use their ABLE account to pay for that, that would be allowed. Assistive technology and personal support services, a standing wheelchair, smart home technology, glasses. Another category would be healthcare and prevention, healthcare and wellness examples. We don't want to prevent healthcare, of course, but where items or services that are not covered by health insurance can be paid for out of an ABLE account, including COVID-related expenses, elective surgeries, paying for co-pays, paying deductibles, or out-of-pocket costs can be covered there as well. Let's go to the next slide. So financial management and administrative services. So we have learned that ABLE accounts can be used to pay for repayment of SSA overpayments. Legal fees can be paid for out of an ABLE account. Basic living expenses now and in retirement, things such as food, grocery delivery, shelter, rent or a mortgage payment. And finally, funeral and burial expenses can be paid for the ABLE account owner after they have passed. So any remaining funds in those ABLE accounts can be used to pay for outstanding expenses that might exist, as well as funeral and burial expenses. So let's go to the next slide. Other expenses could include disability-specific outings, such as camps, conferences, travel and vacations to learn new skills or enhance independence and quality of life. Basically, things that are illegal cannot be paid for out of an ABLE account. We just want to put that on there. The ABLE account owner does need to keep receipts for those qualified disability expenses that they paid for the ABLE account for the calendar year, and the receipts really should be kept for at least 3 years. Next slide. We want to end on this slide because we've covered some information here, but while the qualified disability expenses, those categories are really, they're the same in every state across the country. And it is important to know that assets in the account and distributions for qualified disability expenses are disregarded, or they're given special treatment in determining eligibility for most federal means tested benefits. That's really crucial. We have a decision guide, folks. We have a lot of decision guides, but here's another one on how to determine whether something is a qualified disability expense. So you don't have to remember everything I just covered. You can just check out that decision guide. And with that, I'm going to hand it over to Nathan to talk about how to choose an ABLE plan, and not just for anyone, Nathan. I know it was super easy for you to do this, but it's not so easy for everyone else.
It was. I kind of looked out. I'm from Ohio, and Ohio was the first state to establish an ABLE plan. So in 2016, when I opened mine, I had one option, and it so happened to be my state of residence. But ABLE NRC has an abundance of resources to help folks evaluate all of the different ABLE accounts. I'm just thinking, as we're talking about.
Oh, and if we go to the next slide for the person who's leading our slide deck.
Oh, yes, I apologize. But I was thinking, as we're finishing up QDEs, one of the options we talk about when evaluating an ABLE plan is the ability to track expenses to really make that reporting for the IRS easier should it come down to it in the future. But let's get back to more about choosing an ABLE plan. So there are more than 45 ABLE plans available from which to choose, and actually there are 49. A person can open an ABLE account in their state of residence, or they can choose to open an ABLE plan that is open to out-of-state residents. Next slide. We always want to encourage people to explore their ABLE options because all of the plans are really different. I know, sometimes I have trouble sleeping and I'm a little wonkish, so I love to just browse the different ABLE plans and just kind of pay attention to maybe they have different investment options or different ways to track expenses or things like that. Or different levels of risk, let's say. But a plan might offer specific tax advantages like tax credits or tax deductions, and those might be available for in-state or out-of-state residents. There are fees and different investment options and various ways that ABLE account owners can deposit and withdraw money to pay for qualified disability expenses from the ABLE account. Next slide. Most of the ABLE accounts are open online. I think that's done to really reduce the overall cost of administering the programs. However, a person can contact their specific ABLE plan if they need assistance with a paper or braille application, or to ask a question or need some other reasonable accommodation. The ABLE account can list people who have a power of attorney to help the account owner manage savings and investments. And that power of attorney can be limited to viewing information or conducting transactions. Next slide. The ABLE National Resource Center website includes comparison tools, and I was alluding to those a little bit earlier, to help people compare the various state ABLE plans. We have a 3-state comparison tool. It pulls up 3 different states, and you can compare them all side by side for a variety of options. There's a plan features tool where we can select a state and submit to see all of the plans information. And then there's also a map of the USA ABLE tool. Let's go on next. We also have a variety of downloadable flyers for handing out to customers, employers, schools, and service providers. One of my favorites is actually listed on this slide, the ABLE NRC roadmap and the ABLE NRC BIPOC toolkit that my class of ambassadors worked hard to give feedback on for outreach to BIPOC communities.
Mhm.
And we also have the decision guide on selecting and opening an ABLE account. Miranda, did you have anything you wanted to add on any of these resources or how to choose an ABLE plan?
No, I think, hopefully you're starting to see a theme, folks, about those ABLE decision guides. You can definitely take the PowerPoint from today away with you, but those decision guides really cover a great deal of the content we're covering here today and can be used effectively with those that you're working with, serving for yourselves, your families, who might be interested or eligible. I do want to say, so that ABLE NRC, the BIPOC flyer is one of the documents in that broader toolkit that we worked on, that we developed last year. You'll see information in Nathan's story and a blog, and I think we did podcasts in there with yourselves as well as other members of our BIPOC ambassador outreach work group, serving Black, Indigenous, people of color, to increase the focus in the outreach to folks in those communities who can benefit from an ABLE account. So Nathan joined us last year, and he's been doing an amazing job along with our other ambassadors in that area. Let's go ahead and go to the next slide, and I'm going to start covering here ABLE and means tested benefits. So we can see here that Supplemental Security Income, SSI, is the only means tested benefit that provides a limit to the amount of ABLE savings that will not be counted as a resource. So keeping in mind here that SSI limits countable resources to $2,000 for an individual. Up to $100,000 is not counted as an SSI resource when it's saved in an ABLE account. So that's something you're really going to hear. That doesn't mean you can't go above that amount, but the SSI check will go away above the $100,000 amount. If the amount in the ABLE account goes lower, when considered with other sources, that check will resume. But if we go to the next slide, we'll see a little bit more information about this. Yeah, this talks about how the extra money is counted towards that SSI resource limit along with any other countable resources. So the $100,000 in the ABLE account, and then you're going to have that $2,000 could be held in another account. And when you exceed that, that's when you start to get into that situation where the SSI check will then be suspended unless the amounts drop below. So countable resources for SSI include cash, a bank account, life insurance, cash surrender value, a life insurance cash surrender value, retirement accounts when the owner has an option to withdraw a lump sum, and more. So we've got a link here to countable SSI resources if you'd like to check that out. Let's go to the next slide. So if the balance is more, as we talked about here, while the SSI check might go away, Medicaid eligibility continues, and that's really crucial. So keep that in mind. And that's why we want you to know that $100,000, that's only to take into consideration with SSI. Medicaid eligibility, people can continue to be eligible for that. And that's, we can't emphasize that enough, right, Nathan? It really does make a
Absolutely.
difference, and it's an important point for all of you to take away. The rule applies so long as non-ABLE resources alone are not over the SSI limit. And otherwise the person could be determined to not be eligible for SSI. Let's go ahead and go to the next slide and talk about when family and friends deposit money directly into an ABLE account. The ABLE funds can be spent on food and housing without reducing SSI due to in-kind support and maintenance, which is a type of unearned income. So this is a strategy we see often, and it can make a significant difference. Let's go to the next slide. So a person can save up to the ABLE account limit, the state balance limit. So the different states might have different limits on the balance they allow in that account. And it can vary from 235,000 to 550,000, depending upon the state. The balance is not counted as a resource by other means tested benefits programs, such as FAFSA, the free application for student aid, for federal student aid, it should say, SNAP, Supplemental Nutrition Assistance Program, as well as Medicaid or any type of Medicaid. And let's go to the next slide. For Social Security Disability Insurance, SSDI, HUD housing assistance, and Medicare, they do not count resources. So eligibility for these programs is based on countable income. An SSA or an ABLE account owner who does not receive a benefit or who receives FAFSA, SNAP, SSDI, HUD, and Medicare can save up to that plan's balance limit. And guess what? You're starting to see a theme. The decision guide we have right here, understanding ABLE accounts and public benefits. Those decision guides are all on the same page of ablenrc.org's website, and we'll show that to you at the end, but we have that decision guide available for you to use. And it's kept updated year to year. So it's a nice tool to access regularly because you'll find the most accurate, up-to-date information. If you're looking at this in 6 months, this might change on this slide deck, but it won't on that decision guide. It'll be accurate. Okay, let's go to the next slide. And I'm going to hand it over to Nathan. Anything you'd add to what I just covered on ABLE and means tested benefits before you start talking about Medicaid payback, Nathan?
I think I'm just going to encourage everybody to check out the ABLE NRC decision guides. I know how much work that you all put into making them as useful as possible. I know they can be a bit technical, but I know that when I was first starting out in my journey, I didn't have, any resources. There was not a lot of development at the ABLE National Resource Center, and being able to have those decision guides would have assisted me greatly. And they go into so much detail about the entire process because it's so confusing to navigate sometimes with public benefits, and to just have that resource there is invaluable. So I just want to encourage everyone to check them out.
Well, in our defense, Nathan, you opened an ABLE account the minute you could. We didn't have a chance to develop these decision guides with our ABLE account owners and family members, but they are a new resource we just developed this past year. It's a very new, young program, but we have this now. So I wish we could give it to a younger version of you and me, but we have it now and it's here for folks.
We're learning from experience. That's okay.
We are. Yes.
And so now I want to talk a little bit about Medicaid payback. So we never like to think about passing away, but time unfortunately doesn't wait for any of us. So when an ABLE account owner passes away and they've received Medicaid services since opening the account, the state Medicaid agency can choose to file a claim for Medicaid payback. But, and this is important to remember, before Medicaid payback takes place, the ABLE account can be used to repay any outstanding qualified disability expenses, including funeral and burial expenses. Next slide. For ABLE account owners who have passed away and had worked and paid Medicaid buy-in premiums, those costs are deducted from the amount of Medicaid payback. And if the ABLE account owner did not receive Medicaid services, the account is not subject to Medicaid payback. Next slide. Many of the state ABLE plans have taken steps to stop or limit Medicaid payback for their state's residents. If Medicaid payback is either paid or does not apply, any remaining ABLE account balance is paid to the beneficiary named in the ABLE plan or within the ABLE account owner's last will and testament. If no one is named as a beneficiary, the remaining funds become a part of the ABLE account owner's estate. And Each of the ABLE plans Medicaid ABAC policies are posted within the comparison tools on the ABLE NRC website.
Yeah.
Is there anything you'd like to add about the Medicaid ABAC process, Marita?
Yeah, just two quick points. One, just because we know you're calling in from around the country, and you may have heard this referred to as long ago, it used to be called the Medicaid clawback, and we still hear it referred to as Medicaid recovery. So if you hear those terms, it means the same thing as Medicaid payback. And I'm just letting you know that because I know sometimes we call different things different places around the country or refer to that. So these three things are all the same. Medicaid clawback, Medicaid recovery, Medicaid payback is all referencing the same thing. One other thing, on that first slide Nathan covered, talking about how it really is any outstanding expense or funeral or burial expenses, legal expenses that might have happened after the person has passed, those expenses can be paid out from the ABLE account. So, if folks are in a state where there hasn't been work done to address this at the state level so that those funds can't be recovered from an ABLE account, we have seen people who save up for things they need and then keep the balance a little bit lower, maybe around 10,000 or so, to just pay out those expenses. So that's something that people have done, that we've seen people do. Just want to reference that. So people find ways when they're thinking about these factors on how to make the ABLE account really work for them. If we go ahead and go to the next slide, I'm going to just talk about a few other pieces of ABLE information that we think would be important to share with you and for you to consider. So a couple things here. An ABLE account owner can choose to transfer or roll over their ABLE account balance to another state ABLE plan, and they can make that choice up to once every 12 months. So, if you open an ABLE plan with one state, and you decide at a later point that you've done some more looking around and you want to go with another state, you can do that. You're not locked in. There's flexibility here and some competition in this space, and that's good. People can make those choices. It shouldn't be an impediment to getting started. There may be fees for closing and opening a new ABLE account. Each ABLE plan does have fees, and those fees vary. And there are also different investment and savings options for each ABLE plan. And you can look at that in our ABLE plan comparison tools, and our decision guides showcase that as well. So that's really the tool to use to help someone start understanding which plan they want to look more into in order to decide which one best meets their needs, using those tools we have available on our website. They're right there on the homepage. Let's go ahead and go to the next slide. So other information that's important to consider: an ABLE account owner who works and contributes a portion of their earnings into an ABLE account can qualify for up to $2,000 in savers credit when they're filing their income tax return, or up to $4,000 for a married couple who's filing jointly. And we have a link here to IRS information on ABLE accounts. We work closely with Don Dill also. We know you just heard from him. He's going to be on a panel with us on Monday, folks, at the kickoff of Able to Save Month, which I'm going to be talking about here in a minute, but I'm stepping on my own toes. Let's go to the next slide. I do want to, on this next slide, guess what I have here? A list of the decision guides we currently have. And we continue to develop new decision guides all the time. And while they're pretty technical, because we do want to provide the citations and make sure that it's very accurate, the information that we're providing, we do hope they're also very usable for folks. And we grow these. We do this based on what the questions are that ABLE account owners and their family members around the country have given to us. What information do they want more clarification on in an easy to find format? So here's what we have so far for decision guides. We have the Am I ABLE eligible and how do I open an ABLE account? How do I find the funds to save in an ABLE account? How do I determine whether something is a qualified disability expense? Understanding ABLE account savings and public benefits. And guess what? We referenced all of those in our discussion here today. We also have ABLE accounts and working people with disabilities, selecting and opening an ABLE account, managing an ABLE account, and we do have coming soon, understanding ABLE accounts and special needs and pooled trusts. And we're also developing a few other new ABLE decision guides as well here at ABLE National Resource Center. If we go to the next slide, we do have some additional information, things that we've identified, such as our decision guides, federal guidance, ABLE plan comparison tools, our Able to Save information in podcasts, our newsletter. I'm seeing here, it looks like, if we go to the next slide, we have a wealth of resources, webinars, all of that. Just check out our website, check out those links. But really, I want to take a minute here before we go into our Q&A to give a plug for our Able to Save education and outreach. We do a month-long grassroots education and outreach campaign every August. It starts August 1st, which is this coming Monday. We're 2 business days away. You will see featured Don Dill with the IRS. We have a representative, Betsy Blair from SSA. We are going to have another ABLE account owner and family member, as well as National Association of State Treasurers, who oversee most of the state ABLE plans. They're going to be joining us as we kick off on week 1 this Monday with a panel, Welcome to Able to Save Month. Week 2 is going to be focusing on, and we kick it off with a panel on how to become an ABLE account owner and achieve a better life experience. Week 3 is focused on how to help a family member become an ABLE account owner. And those will have panels of actual account owners or family members speaking about their experience, what they've done with their ABLE accounts, how that's been a game changer for them, and sharing some strategies and resources. Week 4, we're going to hear again from a representative from National Association of State Treasurers, as well as some state ABLE plan administrators on how to open and use your ABLE account. And week 5 really is that call to action. What are those next steps to take with your ABLE account? So our goal here with August is for folks who want to hear more about ABLE and take it in and figure out if this is going to work for them, how they want to move forward with that. It's for folks who have not opened ABLE accounts to date. So we encourage you all to join us and listen in, as well as share our Able to Save campaign across your networks. And if we go to the next slide, I just want to thank Nathan for joining me and for all of you for inviting us to be here today. I know we're going to open up for some questions, and we might, if they get real technical, lean into Lori and Marlene's national level expertise with their backgrounds. But I'll hand it back to you, Johnette.
Thank you. This has just been wonderful. And I would like to open it up to questions here and just remind everybody the reason that we chose to have this program presented July 28th was because of the upcoming National ABLE National Resource Month in August, and how important that was. And you can see all the interesting and wonderful things that are going to be happening. I really would like people to, ask some questions here. I'm looking in the chat room. I haven't. Would anybody like to just raise their hand? I have a couple, Nathan. One is to ask you, if an individual with a disability wants to open an ABLE account, but they don't have, where do they go? Like if their organization doesn't have an ABLE, I mean, everything is here, but if people don't, where do they go to start this conversation? Who's the trusted person in an area that someone can go to?
So first of all, I want to thank you, Jonette, for having us. It's been a really great opportunity to be able to come here and present for you all. And to your question, I think developing the circle of support, I think, is one of the most significant barriers that we see toward wider able adoption for various reasons. Some people, struggle with technology, or they just need assistance getting the account open. And at least in my experience, when if a person doesn't have someone in their life directly that's able to assist them, there are usually community organizations. Maybe it's a center for independent living or a disability related organization. I know in Ohio we have county boards of developmental disabilities that support folks to open able accounts. So it's going to depend on the community organizations that are available in an individual's area, or hopefully they've got some natural supports, family and friends in their life that would be able to assist them in getting that open. Miranda, I don't know if you have anything you want to add.
I think you did a really great job covering that, Nathan. And I also would say that, Able National Resource Center, we have a great deal of information about all the different ABLE programs, and we answer 13 basic questions in our comparison tools, and you can see what's similar across programs and what's different. So for someone who's getting some help or needs to make it a little bit easier to process, where would I even get started? Those are good tools and resources for folks to lean into and using. If someone's helping someone else open an account, being able to look at the selecting and opening an ABLE account decision guide will be a really good resource for you, help you think through some questions and where do we want to go. But like Nathan said, that trusted circle of support, whoever may be part of that circle of support, and then also thinking about who can open and who can manage an account. And I went through that list there, and we have a decision guide that includes that information as well. So I'm wondering, Jeanette, does that answer your question?
That is very helpful. Thank you. Karen, did you have a question?
No, actually, I just wanted to comment. I'm in Kentucky, and we're part of the Stable family. And what we did in Kentucky is our treasurer's office started right off the bat, modeling after the National Resource Center ABLE ambassadors. And so we have ABLE ambassadors around the state. And then each of us try to make sure all of the local agencies in the regions we're in know who we are. And so we can at least begin. We can't always go, especially with COVID, to go and help people, although we have helped people open their accounts. So I'd encourage any state that's has a program to, look into setting up ambassadors around the state, because they're a mix of family members, people from agencies, as well as individuals with a disability.
I'm glad. That's wonderful that you're doing that, Karen. And when Karen says she's a member of the Stable family, what she's saying there is Kentucky and Ohio are part of a group of, I think it's 12 states that have come together as a coalition under Stable. 14 now. Okay, you've grown. And there's other larger groups. Some of them are standalone. They're getting some economies of scale and good sharing of resources and very similar plans. And those who are managing those plans. But I would say for those ambassadors or for case managers or anyone else, our point with ABLE NRC's resources are to say, there is some well-intended but misinformation. It's not disinformation. It's not purposefully wrong, but some people might have information that's a little old or, that might not be quite right. And using those decision guides. So I would encourage ambassadors, case managers, independent living specialists or others to really use the tools we have for you. They're also, family members or individuals with disabilities themselves can utilize those tools as well. For anyone who needs some support, having someone in their support, using those decision guides, the resources we have, we just want to make sure the information is really accurate for those people who might be in those types of roles.
Yeah. Karen, would you advise, we have a lot of SILs on the call, and for people that may not have, yet promoted the ABLE accounts, would you advise that a core group get together and kind of look at the decision? Begin a conversation of the decision guides and all the resources that the resource center has. What do you see as working?
I think anytime on any of these issues for disability that you can get a core group together to come to decisions of how you're going to do things. I mean, out of our stable ambassadors, we do webinars all over the state. Mostly now, they're mostly online, but there's a few conferences coming back. And if the treasurer's office can't make it, we go. And actually, I think sometimes they get more out of us attending the meetings because many of us have family members or have stable accounts, and we're able to talk about different things, not only just the stable accounts, but the one thing I didn't think you guys mentioned was a stable card.
Well, so the different, because there are actually 49 able programs. So there's 14 with stable, and many of them do have a debit or a prepaid card option, not all of them, and that
But
can
they're stable,
increase
right?
the ease of use, being able to access the funds in that able account easily with that debit card, that prepaid card, whatever the specific plan offers. Not all of the plans offer that, Karen, but because that's part of what we have in our comparison tools, or what are the different features of those different plans, and many of them do offer that, and it allows people to easily access those funds. Interestingly, the plans that don't have a debit card or a prepaid card, one of the benefits folks find of that is, hey, I want to save my money and I want it to grow, or I want to invest it, and if I have a prepaid or a debit card, I might access those funds a little too easily. It makes it a little too accessible for me, and I want it to be a little bit harder to pull down those funds. So it really depends on the circumstance of the person and what their goals are with their able account, which plan is going to be the best for them. I was surprised when I learned that that was something that a number of people have chosen not to go with a plan with the card for that reason. Many others want that easy access though. So there's so much flexibility there.
Yeah, I know
You're right.
from my
We could have had a lot longer of a
sorry.
presentation, Karen, if we talked about all the different features.
Right, and I
Nathan,
should
go
have
ahead.
used stable. I'm sorry.
No, that's okay.
That's what I talk about all the time.
Yeah, no, yeah, go ahead, Nathan.
No, it's interesting that you relay that story, Miranda, because when I first opened my Able account, they had the debit card option available, but I wanted to really focus on saving money because I didn't anticipate needing to immediately spend the funds that were in my Able account. But
Yeah.
as I'm pursuing employment, I recognized that the debit card option would give me an easy way to track my QDEs
Yeah,
and to make it more convenient, for to have funds available to support my employment and healthcare related needs on a short-term basis. And that's really an interesting part of how I save money in my Able account. I save some money, for longer term kind of retirement type savings. And then I also, because I have multiple layers of investment options, in the safest investment option, the savings account I put money for short-term disability-related expense needs so that I don't have to worry about the value of the retirement account fluctuating.
right.
Excellent. I have a question, Nathan, around the qualified disability expenses and just keeping track of the receipts. Because when I was involved with the pool trust, I was president of the board for a pool trust, and in those days, it was before we had the electronic everything going on, but is it still, how do you do it? How do you keep track of your receipts so that if somebody comes to you, you can pull them up? And
in my case, technology is my friend. I think smartphones for people living with a disability have just given us tremendous capability to do a lot of things more independently. And in my case, it allows me to be significantly more independent with finances. And what I usually do is take pictures of the receipts that are QDEs with my smartphone camera and upload them to a cloud storage. I still retain paper copies as a backup, but I like to do that to keep them organized. And then another way I do that is to try to filter as many of the items that are clearly QDEs through my stable account debit card to also have that additional level of tracking.
Yeah,
Right. Many of, and not just stable, but the other plans that have those debit prepaid cards, if you're making purchases there, they'll track those receipts and what categories they fall under.
that's a really good reason to have that debit card.
It is.
Yeah. Does anybody else have a question? It's just been excellent. Well, I think I think this has just been wonderful, and I so appreciate you all and the work that went into this, because this has been a topic that has been asked for. So we're really proud to have this, and now we have the resources to share with all of our participants in the e-learning network. I'm just going to put it out there. If anyone has any more questions for any of the team that's here today, because it's not very often we have such a group of people gathered to answer our questions. We really appreciate it. I want to thank you, Miranda and Nathan, for your presentations, and Marlene for attending, and
Lori, yes.
Laura. Yeah, thank you so much.
We hope you all will join us for Able to Save, and that Able National Resource Center website, it continues to grow with information. Come and check us out often. If you have questions for us after today's presentation, one of the easiest ways to get in touch with us, if you're not finding information on our website, you can email info@ablenrc.org. And we just really appreciate the opportunity to be here with all of you. Thank you for helping us to get the message out about ABLE accounts and really build that education and awareness. You don't have to get a PhD in ABLE accounts. You have a good understanding and base knowledge, and now you know the resources to go to that will make you look incredibly knowledgeable about ABLE accounts. So lean into those, use those. We're here to support you with that. Thank you again.
Thank you so much, Miranda. Thank you, everybody.
Thank you.
Thank you.